childbirth is overwhelming and empowering. And it's known as the postpartum sex storm. That's the medical terminology for it. Because it's the turmoil and the roller coaster of number one, hormones. So estrogen goes very low, prolactin from breastfeeding suppresses libido, and the testosterone is low, which what is libido made out of? It's your desire. It's what fires up in your desire and wanting to have sex. So we cannot be oblivious to that. Apart, so hormones make you who you are, how you feel, how you react. And you need to accept it and be patient, because you cannot change it. The body will bounce back. And in the meantime, remember, it's empowering, overwhelming. So just wait for this bouncing back of the body. You cannot resist it. Your partner will have to understand it. The second one is the body recovery from episiotomies and pain, and you cannot rush it. There's many other ways to enjoy intimacy than intercourse. So because if you fear the pain, the worst thing is having pain during intercourse. So then don't push your body, accept it, and your partner will need to communicate and talk. Sorry, I'm going into psychology here. But you need to talk about it, because you cannot change it. The third important thing is how depression sets in. So we need to accept it, appreciate it, and seek help. So we've got the hormonal changes, the physical body changes and the pain, and the depression that makes you pushing everything away. It's overwhelming, but empowering. You need to get this empowering and be patient with it. So that's how it affects our bodies. Now, how can we fix it? I think it's part of the question. So that's what regenerative medicine to have a big role in reversing that, what happened. The stretching of the vagina, Mindy is coming to tell me I'm numb down there. I can't orgasm anymore. I'm very dry because I have no estrogen. It's just plummeted. So it's important for us to fix everything the way it needs to be fixed. Or now I have a bit of incontinence. So the beauty of all of that, that's all now can be fixed. So the mum makeover is not just lifting the boobs and the tummy tuck, but no, we need to get the vagina organ health, revitalizing the whole tissues. And I always say, if 10% of what happens to the vagina happened to the heart, you'll be dead long time ago. So this organ has been through an enormous amount of war. So it's important for us to say, okay, how can we fix it? How can we regenerate it? How can we factor the tissues? The vessels will shut down. How can we get more vascularity and lubrication? How we can thicken the walls of the vagina? So this is when regeneration medicine comes to say, okay, laser works. So the laser comes into 4 modalities. 1 is incontinence laser. 2 is renovating laser to the vagina. Then the pelvic organ prolapse. With all this pushing for babies, the uterus will come down, the bladder will stay inside, the rectum comes inside. So this whole area, as well as there's something called vaginal relaxation syndrome, where the vaginal wall relaxes. So we need to revitalize, renovate the whole area, build the walls again. Do not ignore it, because you're not allowed. I mean, if I take my glasses off, I can't see you. My choice, but I love to see you. I love to get healthy vision, healthy sensation. So it's important for you to say, what is going, how can I reverse what happens? And these days you can. I'm a great lover of the growth factors, or the PRP, or the orgasm shot. And it's the same thing. So the orgasm shot, or the shot, helps enormously for all ages and stages, from 18 to 85. That's how all my patients are, the group of my patients. So don't accept it, be patient, communicate, and fix it. And the most important thing that I learned again at my rehearsal last night when the master said, "You're all amazing, but you don't practice enough. Go and practice a lot." Okay, that's the only way that your talents, I can sing, he told me, look, you don't practice enough. Go and do it well. So please practice. Okay? That's what you need to do.
Thanks, Mike.
So obviously go back to hormonal changes with different stages of life. Now, I don't know if you, Shikita, want to read the book instead. And I have patients who come and say, I'd rather watch a movie rather than having sex for 20 minutes. It doesn't do anything for me. So allow me to put them all in one basket, whether you're 80 or 85. In my experience as a doctor, it's important that sex starts in the brain. And this is true, anatomically. There's a spot in the brain called the amygdala. And the amygdala is being discovered that it associates all your experiences and deliver your hormones for sexuality. So you can set your brain in a way that I want to have sex all the time. Coming from a man, obviously, it's different. So, and women will say, what do you know about orgasms? Female orgasms. Well, I think I heard more than anybody here in the room from our 4,000 to 5,000 patients, their story. And clinically, we can, what Charles Arnold, the inventor of the Earthshot, called activating the female orgasm systems. Because 80% of women do not orgasm vaginally. Wow. Then, in my opinion, it's not 80%, it's 95% from the people who come say, is that a thing? So, the brain can have the biggest power for you to live in that space. If orgasm doesn't come, you would not be looking for it. You read a book, you watch a movie, and it becomes a chore. So really, from the medical aspect, we need to activate the vaginal orgasms. I have a 21-year-old said, I don't know what to do, I just hate my boyfriend. I do not orgasm. It's such a very common thing. Culturally as well, it's a huge thing, but the 50 and 60, where's my clitoris? I don't have one. So culturally, they've never been taught sex. And I have a boyfriend, he looked for it, he couldn't find it. Right? And when I was in the Earthshot, I've seen a huge clitoris. I don't know whether they're blind or they have no idea. So having an idea about your vaginas and how it works, about the O spot, the U spot, the B spot, the A spot, the posterior wall of the vagina, cells of vaginas, and what is called the vagina pacemaker. So there's a heart pacemaker, there's also a vagina pacemaker. And we will not start that, but you can Google it. It's very great, but it's very important to activate your pacemaker. So you stop reading books, and so you stop watching movies and have sex. And practice hard. Okay? So at all ages, it's not at 30s, it's at your peak of sexuality, and then you fall pregnant, and things, you have the sex storm happening, and all the roller coaster of sexuality. At 40, the perimenopausal stage, where you struggle with hormone shifts and dryness and pain during intercourse, and then 50, it's been building for 20 of your life from perimenopause to menopause, and you start to have pains and so forth. So we can change all that, and that's very important for you. There's no expiry date to sex; it doesn't expire. When the 85-year-old came and said, I'm with a 60-year-old boyfriend, fix me, I want to have good sex. Incredible. Another one, 82-year-old, came and something was happening in the air, all the 80s were out there, and there's no expiry date to sex. But first of all, activate all your spots. Get them fired up. If you have a Ferrari that has no fuel, you need the fuel behind it at all ages. I'd like to ask you all, how do you feel after a good orgasm? Great energy? Amazing energy, you're a different person? Yeah? And there's something called la petite mort. La petite mort is the little death. Little death is how you feel after the orgasm, where the whole body goes to total shutdown. And there is a mixture between your sympathetic system, which is your anxiety, your energy and your sexuality and your releases to la petite mort, to a death of your whole body just relaxes. This is what creates your energy. Now, what creates your happiness? People take antidepressant tablets. Why? The best force your serotonin and oxytocin is a good orgasm. If every person can orgasm well, you don't need antidepressants. This is the sexual energy. This is how our body is built. We ignore our body, we don't know, we just think sex is only for the activity of sex, but this is how we are built. So it's important to think of your sexual energy and the mixture of the total relaxation to the extent it's called la petite mort, the little death, to the excitement, and that's how the mix of all things work together. And I'll go to the love muscles. The love muscles of your, as it's called the pelvic floor muscles, such a boring name to it. It's actually called the love muscle, the pubic oxygenous muscle, and these muscles, you can exercise them with sex to an extent what's called le pompoir. And the pompoir is sexual activity that you can get all your muscle action happening while you're orgasming. What I want to get to is a mixture of everything happens in the body. The whole, it's, in French we call it bouleversé. Everything is changing. All your senses, all your energies, if I use your sexual energies from 0 to 1,000,000, are all happening. And let your body enjoy this. And let your body release the best antidepressant, the best happiness hormones for best sexual energy. So this is what we want and that's what we're looking for. Now if I go back to the opposite, when I see that the body now is aging, something we can't run, we can't stop the clock. And the body's aging and menopause happens, elasticity of the vagina is decreased, atrophy, dryness, thinning, itching, and then decrease the libido because your hormones are not there, number one. The DHEA, which stands for dehydroepiandrosterone sulfate. Stock drops, testosterone. Yes, you have testosterone, not as much as to grow hair, but you need a lot of, some of that to fire up your sexuality and libido. And it becomes a cycle. Orgasm, vascularity, sensation, happiness, and becomes addictive. And I think once you lose this addictive feeling of wanting, you have to ask yourself, where is my sexual energy going? I'm going with the same thing, the energy and the sexual energy you feel, and how we let menopause and perimenopause let us give up. And I almost said there's no expiry to sexuality. And the more you practice it, the more you improve your elasticity, vascularity, lubrication, hormones. This is what fires up your Ferrari. You have to maintain this energy running. If you slack, if you're negligent, I hate people who are negligent to themselves. So reversing menopause, you have to do it by checking hormones. If the body needs estrogen, with testosterone, DHEA, I believe a lot in local rejuvenation of the vaginal tissue by growth factors, because at all thickness of the vaginal wall, it becomes thicker. Using of the laser machines for renovation, that's what's called, to renovate the vaginal tissue, thickening of the vaginal tissue, you must maintain it. So we can reverse the effect of menopause. And when you start to orgasm well, the brain will want it more because sex starts with the brain.